Good evening. Thank you for joining us this evening for another talk about COVID-19 in the African American community. If you've been watching the news or reading the newspapers, you see that numbers are continually rising here in Arkansas as well as throughout the country. And just a couple of months ago, we would have thought that we were at the end of the pandemic, but it seems that we are facing another surge with the new Delta variant, and I've heard news of another variant on the horizon. So, you know me, I'm Brian Rodgers, Community Relations Liaison here at Mosaic Templars Cultural Center, and I am not a doctor, but I do have a doctor with me tonight, Dr. Geraldine Jones, who most of you know. I am not going to attempt to introduce Dr. Jones because I know I'll miss something. And so I will let her tell you what she wants you to know about who she is and her credentials and why she's qualified to speak on COVID tonight. Dr. Jones, welcome again to another Mosaic Templars Facebook Live event. You were so gracious to moderate our Juneteenth panel discussion about COVID-19. And here we are just a few short 3 months later, and we're doing it again. So welcome, Dr. Jones.
Thank you for having me. As Brian said, my name is Geraldine Jones. I am an emergency medicine physician, practicing emergency medicine physician, and I also work at the Arkansas Department of Health as the medical director for preparedness and emergency response, and so have been up to my eyeballs in COVID, both from a systems perspective and also from taking care of patients. So happy to be here and discuss COVID again.
Well, again, thank you. And on behalf of our director, Keith Fletcher, and the entire team here at Mosaic Templars, where we welcome you and we thank you for joining us tonight. So for those of you watching live tonight, we've prepared some questions, but we want to hear from you. So if you have questions, please type them into the comments. And as they come through, we'll try to take a moment from our prepared questions and answer and ask. And I'll read Dr. Jones the questions and try to get her answer on any of your questions here live tonight. So Dr. Jones, I have prepared about 10 questions, and I tried to structure the questions kind of thematically, but we may jump around tonight just to give you kind of a heads up on that. So my first question is that, as I mentioned, it seemed a few months ago that the worst had passed and we were starting to emerge from the pandemic. What changed?
So I think you hit the nail on the head when you mentioned the Delta variant. So it is not uncommon for viruses to mutate. That's what they do. That's how they stay alive, is by changing their genetic makeup, making themselves, more virulent so that they can survive. And if you think about it, that is why we require or request that people get a different flu shot every year, because there's a different strain of the flu that comes through. And if you can think about historically, look at what was going on with the HIV virus. So that's another virus, and multiple cocktails were needed, multiple drugs, and then you need a different set of drugs and all of those kinds of things. So what viruses do is that they mutate. And most of the time when they mutate, it doesn't mean much of anything. But sometimes when they mutate, they figure out a way to make themselves even more powerful. And with this Delta variant, the mutation that occurred made it more powerful in a couple of ways. It made it more powerful in that it is more contagious, so it's more easily spread from person to person. And it also made it more powerful in that it tends to make people sicker. So it's a stronger virus, it's a more virulent virus. And so we're seeing with the Delta variant kind of the virus behaving as viruses do. And, without people being vaccinated and those kinds of things, it's really wreaking havoc in the population. And so that's what happened. The virus did what it did. We didn't necessarily do all the things that we needed to do. And so that's why we're in this position again.
Okay, and so the Delta variant It's why we are where we are now. But I've heard that there's another mutation on the horizon that's a new variant. Can you tell us a little bit about that, or do we know anything about it yet?
So the WHO keeps a running list of kind of the variants of the virus. And the one they're now concerned of is a mu variant. And they kind of put that on their variants of concern list at the end of August, so a few days ago. And it's just another one that they're keeping their eyes on, trying to see if it is how it behaves, basically how it behaves in populations. Is it going to be even more contagious? Is it going to make people sicker? Because again, that's what viruses do. They're trying to stay alive themselves. And so that's just kind of an evolutionary thing that they've developed. And so we're keeping an eye on it. But in and of itself, this is the way viruses behave. And again, usually it's not consequential because there's been a number of mutations, even with COVID-19. But the Delta variant is the one that became particularly concerning. And this new mu variant is the one they're looking at now, too.
Okay. So we've been living through COVID for about 18 months at this point, I believe. And so maybe 8 months or so, we kept hearing everywhere on the media, everyone was talking about herd immunity, herd immunity. What exactly is herd immunity? And is that something that is going to diminish the effects of COVID?
So herd immunity is basically a way we talk about populations getting immunity. So when you have enough members of a certain population that either have been vaccinated or have immunity through natural disease, then that serves as protection for those people that haven't been vaccinated or don't have that natural immunity, because the people that have been vaccinated can't spread the disease. So the virus or whatever the disease is can't live amongst the population because there's not enough hosts for it. And so that's what we talk about when we talk about herd immunity. But that requires a couple of things. It requires that, so first of all, the number or the percentage of the population that needs to be vaccinated in order for herd immunity to happen varies for different viruses. So if you think about it, say for measles, they say that you won't have herd immunity for measles unless 95% of the population is vaccinated. Measles is an incredibly transmissible, very contagious disease. And that's the reason we have the MMR shot that is required for students going into school and things like that. So again, you need to have 95% of your population that is vaccinated to have herd immunity for measles. It's different for, say, polio. They say that you only need about 80% of the population to be vaccinated in order to achieve herd immunity for polio. The actual number is still out with respect to COVID-19 and in terms of the percent of the population that you need to have vaccinated in order to have herd immunity specifically against COVID. But I can tell you that here in Arkansas, we are far below that number anyway. As of today, we are looking at only 42.9% of our population that is fully vaccinated. So regardless of what that number is, it's going to be well over 50%, and we have not even reached 50%. So herd immunity is a nice thing to talk about, but we got to do what we need to do to get there, and we're nowhere near being there. So
That's it's I guess it's one of those things that it kind of gives people hope for, especially when there was no vaccine. We kind of, I guess the media was saying, well, we can reach a point where so many people have been infected that we don't have to worry about the virus anymore. But I think that it's interesting now, excuse me, that we're seeing breakthrough cases in people who are fully vaccinated. How does that work?
So we are seeing breakthrough cases. And so I guess let me back up for a second. because you're vaccinated does not mean you will not get the disease. And I want to say, you can still be infected with COVID-19, just because like you can with any other virus. You get the flu shot and it's possible that you get infected with the flu. It could be a different strain of the flu, that kind of thing. But what we do know with the vaccine is that you are far less likely to become severely ill if you have been fully vaccinated. So you might get a little sniffles, or you might cough for a day or two, but you are not likely to end up in the hospital. You are certainly not likely to end up on a ventilator, and you're less likely to die from the disease. So nothing is 100%. So I don't want people to walk away from here and say, well, I know somebody that's fully vaccinated and they got COVID, so I'm not going to get the vaccine. That's not the way to look at this, because there are no absolutes in the humanities. People are different. And if you go back and look at data behind people that are getting sick, that have been fully vaccinated, and I pulled up an article out of the Globe, to the Boston Globe today, because Massachusetts is a state that has very high vaccination rates, but they're also being very transparent with their numbers in terms of people getting infected that have been fully vaccinated and whatnot. And so they have very, very low rates. So for them, they had breakthrough cases are less than 1%. So they have 0.53% of cases are breakthrough cases. So these are people fully vaccinated. And they have 0.02% of their fully vaccinated people that end up in the hospital. And then 0.004% of those patients end up dying. And so that's well below 1%, particularly in the deaths. And then they look at those deaths, and the average age of the folks that died is 81, almost 82 years old. And these people also had a lot of comorbidities that went along with their illness. So their immune system was a bit more on the fragile side anyway. So they did everything they were supposed to do. They got vaccinated, but unfortunately, because of their age and other comorbidities, when they did get infected, it was too much for their bodies. So the way I want to go back and say, there are no absolutes in the humanities. Nothing is 100%. This is another tool in our toolbox, and it's a tool that we know is effective. And so do not let the idea that 0.004% of the patients that have died were fully vaccinated dissuade you from getting the vaccine. Don't throw your hands up and say, oh, I shouldn't get vaccinated because I'm gonna get COVID anyway. That's not the case. You are far less likely to end up in the hospital, to end up severely ill, to end up dead if you get COVID after you've been fully vaccinated.
So, people watching, I want to reiterate what Dr. Jones just said. If you are vaccinated, if you're fully vaccinated, and you somehow are part of that incredibly small number of people who even though you're vaccinated, you contract the virus, the chances of you getting very ill are small. The chances of you being ill enough to be in the hospital in ICU are even smaller. And the chances of you dying are even smaller. So we want to encourage you to get the vaccine. And now that we're talking about the vaccine, I want to, Dr. Jones, talk about some of the pushback that people have about the vaccine. And you addressed one just now about why should I get the vaccine and I can still get the coronavirus, if I can still get COVID. Well, again, she's shown you through statistics from Massachusetts, which is one of the states with the highest vaccination rates, that the chances of you contracting the virus are small. The chances of you contracting the virus and being required to go to the hospital is smaller, and the chances of you contracting the virus, going to the hospital, and dying are even smaller than that. I think you said 0.004?
Yep, 0.004%.
I'm a historian, not a math major, but that seems like 4 out of a million. Is that?
That's about right. I'm not a math major either, but it's very, very small.
Very
well
small.
1%.
Well below 1%.
Yeah.
So that's not a reason for you not to get vaccinated. Another reason that people say they don't get vaccinated is because the vaccine was developed too quickly. Can you discuss and dispel that myth of the vaccine being developed too quickly?
So it's interesting because that was honestly being fully transparent. That was one of my issues too when it first came out. I thought it was done way too quickly. But then I did my research, and actually the technology behind these mRNA vaccines, which is a new way, we're using it as a vaccine, that is new. But the actual technology of using it to treat things is not new. They've been using it in cancer therapy for a while. And what it does, how it's so amazing is that you can take a little piece of the RNA. So taking it down to cell biology, you make your DNA makes RNA, the RNA makes proteins, and that's what kind of fills out the cell. So that's the thing that happens. And with the technology that we have right now, once COVID-19 came onto the scene, the genomic sequence was published really early because we've gotten so good at looking at genomics. So we could scientists could publish the genomic sequence of the virus very early. So that means they had the basic building blocks and they could see what the mRNA was, making the proteins, et cetera. And so they could take that mRNA and they could basically churn that out quickly to make a vaccine. And the way the vaccine works is it goes into your system, and because it's an mRNA, it's coding for a protein so it goes into your cells, it codes for a protein, and that protein makes a spike on your cell, and your body recognizes that spike as being foreign. And so then your body does what it does when things are foreign. It generates an antibody response, but there's also evidence that it generates not only an antibody response, and antibodies kind of stick to the outside of a virus, but also a T cell response, which actually kills the cell. So it recognizes bad and it can attack bad for multiple areas. And that's what you want your immune system to be able to do. And that's why it works with cancer cells. So we know that the cancer cells are basically your normal cells that have flipped a switch genetically and are starting to produce out of control. And so what they've been able to do with that same technology is identify those cells that have flipped and gone out of control. And so then your body can actually target those cells specifically while leaving your normal cells alone. So the technology is not new. Using it in this way as a vaccine is on the newer side, but it still went through the same processes that any vaccines have to go through to get approved. So they looked at it in animals, and then they looked at it in a small subset of people, and then they looked at it in a bigger subset of people, and all of those things had to happen. And they had the emergency use authorization because they saw that it was effective. They saw that people are dying, and they look at when the FDA approves things, they're looking at whether or not the medication or the vaccine is effective, but also whether or not the safety profile is appropriate and that the benefits outweigh the risk. And so we had all these people dying and getting sick, and they were studying the vaccine. And so they said, okay, we're going to go ahead and release this for emergency use because we see the data that is coming back. We see that the benefits outweigh the risk. This is helpful, and it's going to keep people safe. And then now we've gotten the FDA approval, the formal FDA approval for the Pfizer vaccine. And so it's kind of reached that last check mark that says, okay, this is good to go. So these it's a process, and it can seem accelerated, but when everybody's mind is focused on one thing, when you get a bunch of people, and this goes with, look at cleaning your house. If you got everybody in your family to focus on cleaning your house, you can get your house cleaned very quickly, as opposed to if it's just you or just your child. cleaning your house, it's going to take a long time. It doesn't mean that the process is inappropriate or that things were done in a shoddy manner. It just means that when you get everybody focused on one task, you're able to get things through and get things done faster.
So, in other words, the development of the vaccine was like Saturday morning at home with the blues playing. Everybody knows what time it is.
Yes, everybody is on the same page. Everybody was working to the same for the same thing. You had folks, all the scientists at Pfizer, you had the scientists at Moderna, you had the scientists at Johnson and Johnson. Like, these people were all working toward the same goal. And so when you have millions, well, not millions, but when you have several brilliant minds that are focused on one task, you can come out with a product much faster than if you just have one entity focusing on it.
So, continuing to talk about the vaccine, another thing that you're hearing people say is that they're not going to get vaccinated because of the side effects. Like, people are saying that they've become magnetized, their DNA has been altered, it's causing infertility. Is there any evidence of any of these things happening? I know that's an absurd question, but people believe it to be so. So is there any evidence that these things are happening?
No, there is no evidence of any of this. You're not having a chip implanted into you. Like I said, it's mRNA. It's not altering your DNA. It's not going into your DNA and doing anything to your DNA. The process, from that cellular process, the process is DNA forms, DNA makes RNA. It doesn't go back the other way. So no, it's not getting into your DNA. And it's not, what was the other thing? It's not causing infertility as far as we know. Again, it's a relatively new vaccine. And so they're still doing research about it, but as far as we know, as far as we can see, it's not causing anybody to be infertile. I do want to comment really quickly, particularly about that, not necessarily magnetized, but microchips. I've heard people saying that they're putting microchips into you and they're tracking your activity. This item right here is the biggest microchip of all, okay? People that are walking around with their cell phones, people can track you from your cell phones, people, okay? Not the vaccine. If you're being tracked, check what's in your pocket. So I just want to put things in perspective and let people know that that's the truth. You have to be careful about where you are getting your information, and start with approved places such as cdc.gov, the WHO, and they have a list of different places, and check the information. Don't just get it from one site and declare it to be the gospel. If there's something that's questionable or you're not concerned, check multiple places. And then when stuff lines up, then okay, consider that. But if you've got one physician who is writing an opinion piece or a blog on Twitter, check their sources. And if they can't, look at where the information is coming from. Just check the sources. I think that's really important when people are doing research, because I encourage you to do the research. I did the research myself. I didn't just blindly go and take it. And I understand there being a hesitancy to do that. That's fine. So I'm not saying don't question, but what I am saying is look at the resources and look at the sources of that information, because it's not all credible. And one person's opinion in the medical world, one person's opinion means nothing. That's why we have peer-reviewed data. That's why it's important for things to be peer-reviewed, because it's looked at by multiple people and multiple people weigh in. So one person blogging, that doesn't work. That doesn't work.
As a historian, if someone was claiming to be giving me factual information in a blog on Twitter, I would question that, regardless as to who it is, because why are you not, publishing in peer-reviewed journals, and why are you going to Twitter to get the information out there? But that's a whole other conversation. So, is there a cure for COVID-19? I know that people are advocating hydrochloroquine, whatever it is, and ivermectin and all of these other things that people are saying cures COVID. Is there a cure?
So no. Well, so cure.
Okay, let me rephrase. Is
Yeah.
there something that I can take if I contact a coronavirus? Is there something I can take that will make me be well without the virus running its natural course?
So we have some things that are FDA approved that the data has borne out that they're helpful. And let me back up really quickly. I paused at the term cure because I am not entirely sure that people have looked to see once folks if there's a point that at which folks have, once they've had COVID and you check their antibodies and things like that, I don't know, a year later, if the COVID is gone or if their body is showing no longer showing signs of it. So that's why I hesitated a bit about cure. But are there things that can make you better or make you not have the full effects of the virus? Yes, we do have some tools. Monoclonal antibodies is one of them. That's been shown in the data to be helpful. If people get diagnosed with COVID-19, then we encourage them to talk to their physician or go to the local health unit and inquire as to whether or not they're eligible for monoclonal antibodies. We know that getting those early in the disease process actually keeps people out of the hospital. So that seems to work. Once people are in the hospital, treatment is kind of supportive care with things like steroids and remdesivir. I will say that hydroxychloroquine has been shown to be more harmful than helpful, particularly with causing arrhythmias and things like that. So it's not helping your COVID, and it can make your heart beat funny and send you into a bad rhythm with your heart. And ivermectin is the same thing. Ivermectin is an anti-parasitic. And while there is research happening now in terms of looking at it potentially for its use in COVID, the early data that's out is indicating that the doses that you would need to kill COVID, this is actually in vitro, are far too high and would cause a lot of toxicity in the body. And so people are, using doses that are meant for livestock, a 2-ton horse or maybe a 1-ton horse. I don't know how much horses weigh, but going to your veterinary store and getting ivermectin and trying to adjust the dose that this concentration is for a horse, trying to adjust it for yourself, people are ending up sick. There have been increased calls to poison control about people overdosing on ivermectin and things like that. And so it is dangerous. It is not recommended. It is not approved by the FDA. And, it is just very dangerous to take that route. There's, like I said, COVID is still, in terms of a disease process, it's still pretty young. So there's a lot of research happening, and who knows, in the future, there may be some other tools that we have in our toolbox, but right now, those are not tools that are recommended. They're not recommended by the FDA. They're not recommended by the CDC. They're not recommended by WHO or any of the other kind of scientific entities that are out there in terms of developing treatment guidelines for COVID.
You say in the future. Is this not a one-time thing? Are we going to have to deal with COVID like we deal with the seasonal flu? Is that where scientists are in their speculation of the life of this virus?
That's what I've heard, is that the assumption is that this is going to be something that's probably going to be kind of around and ubiquitous and comes up every season. So we will learn what we need to do to combat it. And I want to put this out there for folks that might be listening to. I know this can be frustrating. If you are not in medicine or in the sciences and regularly deal with discovery and new innovations and things like that, it could be frustrating to hear one thing one day, something else the next day, and all of those kinds of things. And let me tell you, as a clinician, it was frustrating for us too, because we would have recommendations for this type of PPE one day, then we'd have recommendations for this type, and then we'd do this and back and forth. And it can be frustrating, but what I appreciate about the recommendations is that they're telling me things as the science is evolving. And so what we know today is different than what we knew 18 months ago. And so I want the best. And so I would expect that if your research from or the research that we have now, or the data that we have now, is indicating that something that was going on 18 months ago or 6 months ago is no longer appropriate, tell me that. Tell me that. I don't want to be stuck in the past. By the same token, it is not a good idea to jump too far in the future. Yes, innovate, but innovate in a way that makes sense, innovate in a way that is safe, particularly when you're talking about something like this. So I think people should be comforted by the fact that the research is ongoing, even though it can seem frustrating that the recommendations change quite often. It is up to your medical personnel to keep up with them. And so don't be afraid to ask the questions and say, you know, why are we doing this now? And we did this before, what's going on with that? That's totally fine to question, but I think you should also, in questioning, make sure that you're letting the science kind of lead you. And sometimes that doesn't happen with folks when they start talking about microchips and things.
I want to pause right here, Dr. Jones, and remind our audience that's watching live on Facebook that if you have any questions that you'd like for Dr. Jones to answer, please type them in your chat window and I'll read them as they come in. Again, we're with Dr. Geraldine Jones, Facebook Live, talking about COVID-19, the African-American community, the vaccine, and the rumors that are out there. One of the other things that I hear Black people, especially Black people, saying is that they don't trust the vaccine because of the history of the medical community with the Black community, which I, as a historian, am well aware of. You know, there was the Tuskegee experiments, there was and I always forget his name, but he's known as the father of gynecology, and the experiments that he did on enslaved Black women in the late 1800s, well, mid to late 1800s. And I get that. Is there a way, now this may seem far out there, but I think people think this, is there a way that they can determine who gets the special vaccine and who gets the testing vaccine? Do you follow where I'm going?
The testing vaccine and the special vaccine. I think I hear what you're saying. Yeah. And I understand the hesitancy because we do have a history in this country of not being forthright with African Americans, people of color, in terms of medical treatment. You've got Henrietta Lacks and her, the her cell line that is provided the basis for numerous cancer treatments and innovations, and was taken from her without her permission. I mean, so the list goes on and on, right? But what I think about looking at it with respect to COVID, if you think about what happened when COVID first came out, we were having issues getting it into communities of color. Like, it wasn't even readily available the way it should have been to communities of color. And so if you think about it like that, it wasn't like it was rolled out rolled out to us first, and y'all be the test individuals, and we'll see if it's okay with you guys, and then we'll take it over here to the majority population. No, it was rolled out, and there were issues getting it into our community. So I think you can look at that fact and view it as saying, okay, this isn't something that they're trying to necessarily play with or test on African Americans, because this life-saving treatment, we didn't even have access to it the way we should have at first. So I would use that as kind of a marker. You know, if somebody is, I don't know how to tell when somebody is in the line next to you. I guess it's a multi-dose vial. If you're in line with one of our other brothers and sisters and they get a dose out of the same vial, maybe you'll feel like things haven't been switched. But I would just say overall, look at how it was rolled out, and it was not rolled out and experimented on in communities of color and then moved on to majority communities. We in fact had issues getting it out to communities of color at the beginning. So taking it that way, you know, feel maybe a little more reassured that you're getting what everybody else is getting.
Hey, we have a question from our Facebook Live audience, Courtney Douglas. Hi, Courtney. We went to high school together. Is there any information on the likelihood of reinfection? For instance, are you more susceptible to Delta if you've had the original strain?
So I don't have exact numbers on that. The immunity provided by the vaccine is supposed to be pretty good. And how it compares to natural immunity, I haven't seen any data specifically on that. I'm not sure. I'm sure someone is looking at it. I just haven't seen the papers on that to talk about that one way or the other. But I do know if the vaccines are like 95, 98% effective, then that immunity is pretty good. And there's some suggestion that it's even better than natural immunity, but I haven't seen anything doing head-to-head comparison. So you're still potentially susceptible both ways, yeah.
So it is possible to have COVID, recover, and then be infected again?
Yes.
Okay, all right. Because I've heard people say that they're not going to get vaccinated because they've already had COVID.
No, and that's why we still recommend that people that have had COVID in the past go ahead and get vaccinated.
Okay. I've also heard people say that they're not going to get vaccinated because they're not allowing children under 12 to get vaccinated. Why are they not recommending that children under 12 be vaccinated at this point?
And so for it's just not, we don't have enough data in that population as of yet. They're studying it actively now, but again, the FDA and the committee on immunization practices and all of those people, they don't make recommendations without data. And if you think about FDA approval of medications, it starts with clinical trials. So a company says, hey, we have this drug and we looked at it in vitro and this is what it's doing. And then we test in animals and this is what it's doing. We would like to go forth and look at it in humans, human subjects, and all of those kinds of things. And so it's a stepwise process, but things don't move from one stage to the other without data. And so there weren't studied. The vaccine was not originally studied in kids, and that becomes a typical thing. It's not vaccines and new drugs, unless it's specifically for children, they're not often studied in children. And so we just don't have the information. And as we get more information and we understand that the safety profile is there, the efficacy profile is there, then I have no doubt they'll make recommendations for folks younger than 12 to be vaccinated, but they're not going to do so without the data.
One of the things that we saw in the original outbreak was that the virus wasn't affecting children as bad as adults. Is that true with the Delta variant?
No, actually, we see the Delta variant is having more of an impact on younger people, um, which is another reason to get vaccinated, because I know I have children at home that are not eligible for the vaccine. And so, what I can do to protect them is to make sure that I'm vaccinated, right? So, this strand and something in the mutation and how it's infecting folks is causing more illness, more disease in younger people. Um, which hospital was it? So a recent hospital talked about, and I'm on weekly calls with hospital CEOs and things like that, and they give data about their COVID admissions, and the average age of the folks in the hospital for COVID was 44. That's young. That's young. And we saw the numbers creeping up at Children's Hospital as well, with a number of children being in the pediatric ICU, a number of children being intubated and on ventilators. Several children were on ECMO, which is the sickest of the sick. ECMO stands for extracorporeal membrane oxygenation, and that's basically taking, you're so sick in your body that you have to take your blood outside of the body to be oxygenated before it can go back in. So those are super, super sick people. And there were several children on ECMO because of COVID. And this is not something that we saw with the first iteration of the virus. And so that's what happens when viruses mutate. You don't know what population is going to be most susceptible. So that whole adage before, when it was like, oh, the kids will be fine, we can let the kids do whatever, the kids will be fine, that's not the case with Delta. So I would say you definitely need to get vaccinated. That's what you can do to protect your kids, because right now it's not approved for under 12.
So we just have a few more minutes, and in that, we just have a couple more questions. One is about, you mentioned that you have children in your home who are not eligible for the vaccine. Is it possible for you to be vaccinated and still pass the virus to your unvaccinated children if you catch it?
It is possible. So that's why it's really important that even if you're vaccinated and you start having symptoms, that you do the things, those what we call non-pharmaceutical interventions. So that's the masking, the social distancing, and all of those things, washing your hands. But what the studies or what the data has shown so far is that people that, even if they are vaccinated and get COVID, they spread the virus for a lot shorter period of time because they have less virus in their system. And so they're contagious for a shorter period of time, and it's harder for them to spread it because they don't have as much of the virus, the viral particles in them. And so it's another reason to be vaccinated. Again, it doesn't make you bulletproof, but what it does do is it lowers your chance of being sick, and it lowers the amount that you can spread to others too.
Okay, and our final question for tonight. So is the vaccine safe for people who have, I'm sorry. So Patrick Jacobs just asked a question that we had already talked about. And so Patrick, thanks for your question. And Dr. Jones said that the prevailing thought among the medical community is that COVID-19 will behave like the seasonal flu, and it'll be something that we have to deal with on a seasonal basis. So thanks for your question, Patrick. Now, back to my final question is the vaccine safe for people who have underlying issues such as diabetes, hypertension, and other issues that may make them sick on a regular basis? Is the vaccine safe for them?
Absolutely. And those are the people that definitely, sorry, there's a fly in here, that definitely need to get vaccinated. Those folks, particularly diabetics, folks with kidney disease, your immune system is a little bit weaker just because of the diseases that you have. And so you need to do everything that you can to make sure that you are able to mount a response against COVID-19. And so absolutely, we definitely recommend folks with underlying medical conditions that they get the vaccine.
Well, thank you, Dr. Jones, for your time tonight. Thank everyone who tuned in tonight. I just want to give you all a heads up that if you're not vaccinated and you'd like to be vaccinated, the Mosaic Templars Cultural Center, in partnership with the University of Arkansas, Partners for Inclusive Communities, the UAMS Emergency.
Our emergency medicine department, our diversity and inclusion
Yes,
initiative. Yep.
and the Greater Little Rock Organizing Committee, and the U.S. Able Diversity, Equity, and Inclusion team are hosting a COVID vaccination clinic here at the Mosaic Templars Cultural Center on Saturday, October 2nd, from 10 a.m. to noon. It'll be outside, so you won't have to worry about being inside with people who are not vaccinated. There'll be entertainment, some free lunch. So please come out. If you're not vaccinated and you're looking for someone to get vaccinated, come out to our vaccination clinic on October 2nd. Thank you all for tuning in. Thank you, Dr. Jones. And have a great evening. And we look forward to seeing you at the next Mosaic Templars Cultural Center event. Thanks so much, you all.
Thanks for having me.